Today we'll be presenting Combating Surgical Skill Decay with AI-driven performance analytics, specifically within the context of U.S. military healthcare modeling and simulation. This is a subject that bridges two critical challenges. First, maintaining surgical proficiency in a force with variable clinical exposure, and second, developing and integrating technologies that can make training scalable, adaptive, and continuous. In this talk, we'll explore how artificial intelligence, specifically AI-based performance analytics, offers a strategic advantage in addressing both. Let's start with the problem. Skill decay is a well-documented phenomenon across technical domains, but in surgery, it carries potentially life-threatening consequences. In the military, surgical readiness is especially vulnerable. Providers face unpredictable clinical exposure, extended garrison periods, and deployments where trauma volume is low. Studies show that fine motor and procedural skills can begin to deteriorate within weeks to months of disuse. Meanwhile, traditional readiness assessments like checklists or time since last case metrics don't capture the nuance of who is actually ready to perform under pressure. This is where healthcare modeling and simulation comes in, providing ways to replicate scenarios and rehearse procedures. But if these systems don't assess or adapt to the individual, their effectiveness is limited. Historically, we've relied on a mix of solutions: mannequins, task trainers, live tissue labs, and standardized VR modules. These tools certainly build baseline competence and confidence, but they share common limitations. They tend to be episodic. They require skilled instructors for evaluation. And most importantly, they don't collect fine-grained data on the quality of the performance. A medic might complete a cricothyrotomy on a simulator, but was their technique safe, efficient, and transferable to a real patient? Traditional tools struggle to answer that. And as the operational tempo increases and personnel rotate through roles and locations, these legacy training methods don't scale easily, nor do they track readiness longitudinally. This is where AI offers a fundamental shift. AI-driven performance analytics enable objective, automated, and personalized feedback at scale. Using sensors, computer vision, and machine learning models, these systems don't just log completion, they analyze how a procedure was performed. Was the angle of incision correct? Was unnecessary force applied? How consistent were the hand movements? These systems create a continuous learning loop. Data are captured, assessed, and used to inform future training, dynamically adjusting difficulty and focus areas for each learner. No instructor necessary for basic oversight. For a military health system spread across the globe with variable access to human faculty and case volume, this makes AI not just a tool, but a force multiplier. Let's take a closer look at the core components. First, we have motion tracking. This captures hand movement, tool trajectory, and economy of motion, metrics that have been correlated with surgical expertise. Second, haptic and force data measure how much pressure a user applies, key for avoiding tissue damage in delicate procedures. Combined with eye tracking, we get insights into visual focus and situational awareness. Third, machine learning models process this data and compare it to expert benchmarks. Over time, the system learns what good technique looks like and generally a personalized performance profile. Crucially, this enables predictive decay modeling, where the system identifies when a user is trending toward skill degradation before a critical threshold is reached. One of the most promising features of these systems is their adaptability. Imagine two surgical technicians. One just completed a trauma rotation at a level 1 facility, while the other was on a ship with no cases for 6 months. Traditional refresher courses treat them the same, but AI doesn't. AI adapts the training plan based on recent performance, retention curves, and even fatigue. This enables just-in-time training before deployment or high-risk missions, and also supports role transitions, such as a general medical officer preparing for surgical assistant responsibilities in a forward surgical team. It's not just about remediation, it's about precision learning. For the military, this kind of system offers strategic advantages. Sustainability, for one. Providers can train and retrain autonomously, even in austere or remote settings. Scalability. Hundreds of users across bases or ships can receive standardized yet personalized feedback. Readiness, transparency. Leaders can visualize the readiness of their teams in real time, who's sharp, who needs remediation, and where to allocate resources. Moreover, AI systems reduce reliance on high-cost, high-overhead environments like live tissue labs or large-scale simulation centers without sacrificing the quality of the training.
Let's compare these approaches side by side. AI presents an opportunity to transition from a static, analog training and assessment paradigm that is subjective to one size fits all, limited in scalability and without predictive forecasting, to a world in which surgeons and proceduralists have objective, adaptive, scalable, and predictive data regarding their skill sustainment. This kind of transformation mirrors changes we've seen in aviation, where simulators with embedded analytics continuously evaluate pilot readiness, not just hours flown. Surgery is now finally catching up. As mentioned previously, AI has the unique aspect of being able to directly analyze and provide continuous objective feedback. This feedback can be provided without the need for expert surgeons or instructors, which makes skill sustainment to be easily accessible based on individual needs. AI offers the promise of rapid, automated, and reproducible surgical performance assessments. AI is capable of mapping both kinematics and video data and can convert these movements into measurable metrics. Some of these measurable metrics include speed and number of hand movements, instrument path, length, and efficiency, the amount of force and torque placed on tissues, needle and tissue handling, and the time to complete an operation. Objective metrics, like the one just mentioned, can help provide helpful performance assessments. They can also help differentiate level of skill retention and areas of improvement through directly measurable data. These measurable outcomes can be tracked to follow skill improvement and skill sustainment. The benefits of AI compared to traditional surgical learning and skill retainment approaches are of much interest. Many studies are finding that skill acquisition and performance are improved with real-time AI instruction compared to real-time expert instruction or post-performance feedback alone. In a recent study by Yilmaz et al. Out of McGill University in Montreal, Canada, they found that real-time AI instruction compared to real-time expert instruction or post-performance feedback alone improved surgical trainees' skill acquisition with decreased risk of tissue injury and bleeding, as well as improved instrumentation use in aspiration, bipolar, and tip positioning. Studies like Yilmaz et al. Are showing how AI systems are refining the way surgical skills are being taught. They are able to provide tailored, quantifiable feedback and actionable instructions in real time. They show significant improvement compared to traditional models that use real-time expert instruction or post-hoc feedback, which often provide more variable feedback that's less focused or is difficult to interpret by the learner. For the military, this kind of system offers strategic advantages. Some of these include sustainability, scalability, readiness, transparency, Moreover, AI has many strategic advantages in skill retention as it can provide sustainable training in austere and remote settings. Through a combination of machine learning, deep learning, statistical modeling, and custom algorithms, AI can identify surgical skill proficiency and skill decay. Its use in combating skill atrophy is unique as it can be specifically tailored to each individual and their needs. The Department of Defense isn't just watching this trend, it's investing in it. The DHA's MHS Simulation Center strategy emphasizes integration of AI, VR, and performance data across service branches. The Joint Knowledge, Skills, and Abilities, also known as JKSA, initiative by the Joint Trauma System uses a dashboard to track provider trauma exposure and procedural currency. The Military Surgical Training Program Management Office, also known as MST PMO, is actively exploring AI-enabled simulation platforms. Naval Medical Modeling and Simulation Training, also known as NMMAST, sites are piloting hepatic enhanced AI training for surgical roles. These initiatives reflect a clear movement towards a future where simulation is not episodic, but integrated and continuous. Looking ahead, we're likely to see digital twins, where each provider will have a digital performance profile updated with every sim session or case. AI coaching, where real-time virtual coaching is based on cumulative user data. Integrated dashboards, where commanders can pull up skill readiness across a deployed unit with actionable insights. Autonomous simulation kits, where deployed with combat teams or expeditionary units, enabling high-fidelity, real-time feedback without external support. These align with our broader DoD modernization goals under the Joint All-Domain Command and Control, also known as JADC2, and future operating environment frameworks. To wrap up, AI-driven performance analytics offer a powerful solution to a persistent problem: surgical skill decay in military medicine. These systems provide continuous, adaptive, and objective feedback, something that traditional systems struggle to do at scale. And critically, they support strategic priorities of the U.S. military, enhancing readiness, force projection, and capability retention. For a force expected to fight tonight across domains with limited notice, this is not a luxury, it's an operational necessity. Thank you for your time, and we are looking forward to our asynchronous discussion on this topic. Please find below a list of our references used for this presentation. Please check them out if you're interested for more in-depth reading